Good afternoon. Today we have Commissioner of Health Gary Cox, State Superintendent of Schools Joy Hofmeister, Lieutenant Governor Matt Pinnell. First and foremost, I want to stress that the state is working with our federal, state, and local partners in order to respond to any confirmed cases appropriately and swiftly and ensure information and resources are available for all Oklahomans. I want Oklahomans to know that we are getting our state agencies prepared. We are praying and hoping for the best, but at the same time, we are making sure our state agencies are ready to serve all 4 million Oklahomans. I have been in regular contact with Vice President Pence and federal officials, and they have expressed they are ready and willing and stand ready to help Oklahoma in any way we need. As you're aware, the situation regarding COVID-19 in Oklahoma continues to progress. The state of Oklahoma remains calm, steady, and proactive in our response. Currently, Oklahoma has 3 confirmed cases of COVID-19. And at this time, there is no sign of community spread whatsoever. However, this is the top priority of my administration, and we are focused on being proactive in order to protect public health and minimize the risk for Oklahomans, especially our most vulnerable population, which is our elderly citizens. Today, I'm issuing an executive order directing our state agencies and calling on all Oklahomans to protect our most vulnerable populations. That includes our nursing homes, our VA centers, and all of our long-term care facilities. This includes reviewing and strengthening visitation policies where needed. As our state and local partners are coordinating their responses, all Oklahomans can do their part as well by using common sense and practical healthy habits, practicing healthy habits. Avoid close contact with people who are sick and stay at home if you are ill. Frequently wash your hands with soap and water and avoid touching your face. Finally, we are working with our schools all across our state to evaluate the developing situation on a day-by-day basis. We want to stress that at this time it is important we remain calm and be judicious in decisions to close schools and business. It is the state's recommendation that schools remain open. The State Department of Health is committed to providing guidance to our local school districts so they can make the best decisions for their local communities. Strong partnerships continue to remain important, and we need the help of our community leaders, our neighbors, and our partners in the media to make sure Oklahomans understand the latest updates and facts. So now I want to turn it over to Commissioner Cox to give a few updates.
Thank you, Governor Stitt. This time in Oklahoma, we have 3 cases of COVID-19. The 2 additional presumptive test results from the Utah Jazz players will be included in the state of Utah's COVID-19 numbers. The Oklahoma State Department of Health Public Health Laboratory received a specimen for testing yesterday, Wednesday afternoon, related to a Utah Jazz player who was in Oklahoma City. We quickly received a presumptive positive test result at about 6:45 last evening, just a few minutes before the game with the Oklahoma City Thunder. A team of nurses, epidemiologists, and physicians worked with game officials to test all the Jazz players, the team personnel, Utah area reporters, and other staff. 58 specimens were collected and tested overnight. We got the results very early this morning. The Jazz players will be followed by the Utah State Health Department upon their return. I'd like to say that I'm very proud of the Oklahoma City County Health Department staff, their nurses and epidemiologists, the State Health Department nurses, epidemiologists, and lab officials, University of Oklahoma infectious disease physicians, and others, as well as our laboratory, because they had an efficient and were dedicated to swift testing process to ensure that we can provide accurate information at the very soonest time that's possible. As a reminder to all who attended the game last night, you are not at risk. If there are concerns, we encourage individuals to contact their healthcare provider or local health department for guidance. We continue to monitor the situation closely while working with team officials, with the staff at Chesapeake, and with other health officials in the state. Our goal is to keep Oklahomans as healthy as possible during this health crisis, and we're encouraging everyone to adhere to preventive measures that we all know about, such as hand washing, avoiding those who are sick. We have protocols in place to protect facilities with high-risk vulnerable populations, and that's a major focus for public health in Oklahoma, such as long-term care centers and nursing homes. Please check our Oklahoma dedicated website on COVID-19 at coronavirus at health.ok.gov. The State Health Department call center is available weekdays from 9 to 7 and from 9 to 3 on Saturday. And that number is 877-215-8336. So we urge those who have concerns about their symptoms to consult with a healthcare provider in advance and not to go directly to a hospital emergency room. So now we'd like to introduce Superintendent of Schools Joy Hofmeister.
Thank you, Governor. Thank you, Commissioner Cox. Nothing is more important than the safety and well-being of our students and their families and those who work in schools to serve them. The State Department of Education has been working with the State of Oklahoma's Department of Health, as well as the Governor's Office and district leaders across the state to ensure that, bottom line, we do the right thing for Oklahomans. With schools on the cusp of spring break, this is a good time for districts to use common sense and take practical steps as students may be traveling. I encourage school districts to follow guidance from the State Department of Health regarding travel for school activities and other events. It's also a good time for school boards to review and plan their plans and policies to make best decisions for students. It goes without saying that we need to underscore that families and students over spring break be cautious and sensible, wash hands and wash them vigorously, practice social distancing, and wipe down surfaces. We truly are all in this together. Our educators care deeply about their students and their families, and I know that their well-being is of paramount importance. Thank you.
Question. Commissioner, can I see if you could clarify the numbers? The 3 confirmed cases, and do you have any presumptive positive cases?
We have 3 presumptive, 3 confirmed cases, and then there were 2 cases that were from the Utah Jazz players that will be counted as Utah numbers. So we have 5 confirmed cases.
Do you have any other presumptive positives in the state right now yourself? The Nervin and Altus positive cases?
Not sure if that includes, the 5 cases includes that as well. That one is included.
Those to be clear, if we get those tests pretty quickly, how soon will those many tests be available for Oklahoma? And how many tests do you have available?
Well, we have the capacity to run about 100 tests a day, and we have a number of test kits. We're ordering additional reagents at the current time, and so we have the current capacity, I think, for about 300 tests. However, there are 2 private laboratories who are in Oklahoma and who either are or will be up and running very soon.
What's the status, Gary, of those three presumptive positives? What they stand right now, are they presumptive positives or are they positives?
The three are positive.
Okay. What is the status of those individuals?
The status of those three individuals, I know Laurence, maybe you have a better update on that, about the three that are currently positive.
Okay, sure.
Could you read it to me?
Laurence Burnett, State Epidemiologist, Oklahoma State Department of Health. So the three individuals that we're talking about, the two Tulsa County residents that were reported earlier in the last week, those individuals have been under investigation by Tulsa health officials. The appropriate control measures have been implemented, such as isolation of those individuals, as well as daily monitoring of any close personal contacts that would be at risk of exposure for the 14 days through the period of their last date of exposure to those cases. The third individual that we're referencing is a new report, so that investigation is ongoing at this time, so that's in progress right now.
Will those two, are they quarantined at home or are they quarantined elsewhere?
They would be isolated at home, which is possible because those individuals did not require hospitalization.
What's the difference between isolated and quarantined?
The difference between isolate and quarantine is isolation is when you have an individual that is actually experiencing symptoms of illness and they could be potentially still infectious. So you want to try to prevent further transmission to other individuals that could be exposed from being in close contact with them. Quarantine is when you have an individual that is not symptomatic, but they have been exposed, and you want to prevent the potential for further exposure if they go on to develop symptoms during the time frame expected, which for novel coronavirus, that would be up to 14 days.
Commissioner, I know we said that people at the game were safe, but is that everyone? What about people that were close to the court?
You want to go ahead and answer? We do have some advice from CDC about that, and so we'll share that with you.
So as part of this investigation, of course, we work with team officials, with others that were on scene to help us understand the movement of the individuals in question. And what we know that with novel coronavirus, the route of transmission is droplets. So nose and throat secretions that are coughed or sneezed within 6 feet around other individuals. And so this is not airborne. This is not as easily transmitted. The people that greatest risk would be those that are close personal contacts. Essentially your household members for the most part and very close acquaintances that spend an abundant amount of time around an individual when they're infectious. So other individuals in the stands, other individuals that might have been working at the game, those individuals are very low risk from discussing the movement of the individuals under investigation.
How were the Jazz players diagnosed so quickly? Were they tested and then they came here, or were they express landed here? Or how did we find out so fast that they were positive?
So what happens is, the NBA has policies in place where they have trainers that are to monitor the occurrence of illness for their players and other staff during their travel. When an individual is identified as having acute symptoms of illness, they are to work with both trainers from both teams and work with local physicians for assessment. When there was a suspicion that there could be novel coronavirus based on the symptoms, there was, as Commissioner Cox referenced, specimen collection and then brought directly to our State Public Health Laboratory for testing. Fortunately, we were right at the process of just starting our normal test run for the day, so we can include that specimen and get a result later that early evening. And this is a process that occurs with other specimens. When we have somebody that's identified through a physician that we suspect may have novel coronavirus, we're able to work with our statewide courier system to get that specimen from the hospital to our public health laboratory and put it into the run.
Dr. Stacy, can you talk about when you think about closing down schools? You mentioned the state has recommended schools do not shut down. Can you expand on that, please?
Yes. The recommendation has been you don't want to close them down too early or too late. You want to try to prevent the spread. So the thought process is if you close them down now, when do they reopen? And so really we're monitoring that very closely. We're as we have community spread, that's when we're going to recommend that we close down the schools.
What's being done with the Jazz and how are they being moved out of the state?
Your recommendation for large events, people are training for the marathon, et cetera, big community gatherings like that. What's your recommendation in this executive order?
So we have not, the executive order doesn't deal with that. We think it is take precaution. It's really our most vulnerable citizens. We have 3 confirmed cases right now. It is a virus, and we have to be cautious. But again, there's 3 cases so far. We cannot shut down our schools at this point or big gatherings. We're leaving it up to the local school districts. They're working with the commissioner and the superintendent of schools you know your communities better, but at this point, that's kind of the state's recommendation.
What advice would you have for people that want to go out and eat this weekend or just be out and about traveling and visiting folks?
You know, we think we think be cautious. The most vulnerable, the AIDS, the people with immune underlying health issues are the ones the most at risk. But yes, going out to eat, going about your normal business, we think that we have to just take a deep breath for a second. We're prepared. I wanted Oklahomans to know that we are preparing our state agencies, but we do not want to we do not want to create a panic or overreact in this situation.
Is there a plan for the Jazz team to move to travel back to Utah, and what might that be? What precautions would we take?
You know, I don't know exactly what Utah's the Jazz's plans are.
Should they be consulting with you guys about that?
We've been in contact. Our epidemiologists have been in contact with them continuously for this whole time, and we're understanding that they either are en route or will be shortly back to their home state.
We saw a player walk out of the back of the hotel into a car with a driver and I think like a team masseuse or something. I mean, is that something that these players and this team should be doing in public right now?
Well, I think certainly when they get back to their home state, then they'll be picked up by the state health department in Utah, and then they'll have those discussions at that point in time.
Lastly, how did the team get 58 tests when there's been so much struggle to get testing done across the country? How does this one team get 58 tests in less than 24 hours?
Yeah. Well, this was after consultation with both our epidemiological staff, with the infectious disease physicians at OU, this was, we didn't even know exactly what the situation was once we got the one positive test. We didn't know, what the extent of that was. So you certainly do want to concentrate on those that had close personal contact with a positive case. In this case, very, very close contact as far as traveling and things of that nature.
That met with the Utah Jazz player when we went to one of the elementary schools, or the high school, Middle High School before.
One of the players did go to Middle, yes, and we've been in contact with their athletic director and with their superintendent of schools, and appropriate action is being taken there.
Right, with the CDC, qualifications for who can receive testing, I was told yesterday by a spokesperson, you have to have symptoms or you won't get a testing. Doesn't that break those certifications?
Well, I think the guidelines are if a physician, if you're either symptomatic or if a physician in consultation with that patient make a joint determination that testing would be in order, then that's what happens.
My doctor recommended a test, but I go get a test now.
Well, if you met those guidelines, and again, keep in mind that while we wouldn't want to overload our state laboratory, there are 2 private laboratories that are available should a physician want to send a sample to one of those 2 private laboratories.
When you see the activity taking place in Hill City schools, what is the appropriate action for those students that had direct contact with someone who tested positive?
We've been in contact with CDC Epidemiology on this issue, and we'll ask Laurence to fill in those details.
How many people have been tested so far in Oklahoma? How many are still coming?
Read to the Mid-Bell first, I'm sorry.
All right. So, as part of the investigation, what we do is we establish exactly the timeline of when an individual actually was to develop symptoms of illness. That is essentially when you start the clock on when they're most likely infectious, and then kind of move forward with that with the movements. So for an individual that would have interacted with other students at a school that was more than a day prior to being tested for screening, then there essentially is no risk, and that's in consultation with our federal officials at CDC. That is why there was no recommendations for any kind of controlled movement or exclusion for the students that was involved with interacting with the player. So the interaction that we're talking about is for an individual that, in consulting with Utah Jazz team officials, is still not experiencing any symptoms of illness. So there is not a risk for prior interactions, because that individual remains asymptomatic.
The third positive case, can you tell us any details about that? Where was that case? Was it in the
I apologize, I don't have details on this individual. This was an early report just earlier today, so we have a team that's conducting that investigation right now. So, did not have a chance.
How many people have been tested? How many tests can you do?
Okay, so how many tested? I have to apologize, I don't have the exact number because of being involved with the ongoing investigation right now. So we're nearing close to 100 that have been tested here. Now, in regards to testing, of course the priority is for individuals that are symptomatic and that have specific exposure risk criteria. So a person that may have symptoms of fever, cough, shortness of breath, and may have recent international travel history to areas that are outbreak-affected countries, or if there's a concern because they were a close personal contact to another confirmed case, which is what resulted in the investigation working with Utah Jazz and Thunder players and personnel as well. Because of the investigation that was quickly done last night with officials, we identified that there are several individuals on the team that were deemed to be close personal contacts that needed to be evaluated quickly. And that also helps them with their preparations for travel back to Utah.
What kind of preparation can be done in public spaces like the Capitol with under state offices?
So in regards to disease risk, I'll just reference that when we're talking about shared spaces like this, really there's nothing above and beyond than normal routine disinfection and cleaning of commonly touched surfaces. So door handles, desktops, and so forth. There are many disinfectants that are available on the market, both for hospital use as well as personal use, that are effective against coronavirus. So really what we're advising is just to continue with your routinely scheduled environmental disinfection of frequently touched surfaces.
For the ground test passengers, and are they just going to spread to the wind, or are they an isolated community? I know there was a phone call yesterday. What's going on with those guys?
So we're still working with our federal officials that's actually involved with the process right now at their stage. As you have seen in previous reports, the individuals were docked. They have been removed from the ship, and they're in the process of screening at each stage of their transport. Those individuals had to be transported to one location where they had to be housed temporarily. Then they're going to be flown out to other locations so they can get regionally located to where we can then receive those individuals. So we're in the process of organizing the transport back to their residences, so that way we can put them under daily monitoring for any symptoms of illness. That way we would know that we are restricting their movement and we'd be ready to test and further investigate if needed.
Are their residences scattered across the state, or are they like all from like Edmond or something?
I'm sorry?
Are there residents like scattered across the state? Is this a diverse group of people, or are they all like a church group from Edmond or something?
So we're not releasing county of residence at this time because we're talking about individuals that are not cases of novel coronavirus. That's our practice, is that we do not release information such as that, and we also have to assure that we're protecting the confidentiality of the individuals. But there are multiple individuals that are residences of multiple counties throughout the state.
That's all for now, thank you, everybody.
Excuse me, the public needs to know the answers to these things. You don't have 5 more minutes?
What happens in Thunder players?
Go one more.
What happens
We
in
just want to know
Thunder
about the Thunder players. Are they going to be out in town, or?
Okay, so this is also something that we've been working with NBA officials to understand their movement of players as they travel from game to game. There's limited interaction between the teams essentially until when they start warming up and tip off. So we're talking about even not really close personal contact. And those are questions that we asked the individual that was confirmed or presumptive positive from the initial test that was done yesterday. We asked them exactly who they've been in close personal contact with so we can identify those specific individuals beyond their team members and other staff that they'd already been traveling with. So we've identified those individuals, have been reaching out to them if we need to further assess and also restrict their movement. As far as other players in the Thunder, they did not have any kind of close personal contact, so there is no need for us to put any kind of restrictions on their movement or advise on testing.